Well, our children head back to school this week. It's exciting, but all of the newness of it can stress them out a little bit.
Yeah, from new teachers, new friends, even new schools. It's typical for our kids to feel stress or anxiety. So joining us for this Mental Health Monday is Dr. Keenan Tam with Healthcare Network. Thank you so much for joining us bright and early.
Hi, good morning. Thank you for having me.
First of all, let's start with, we always want to help. So what can us parents do to help our children make this transition?
I think like you just said, the main thing would be ensuring that children know it's normal to have some jitters going back to school. And just hearing out those concerns and talking towards some solutions to solve their problems. And I think that's the best thing to do, just to normalize that, there's anxiety going back to school.
And I think, a lot of times be prepared to, as a parent, for them to say, I'm fine. And just keep having that conversation with them,
He's got a preteen at home, can you tell?
Yeah, she doesn't want to talk about anything right now. It's really tough. So how can we know if the back to school stress maybe is more than what we would consider, quote, normal?
So if you don't see the stress resolve after about 2 weeks, you may wish to talk to your healthcare provider. But some other things to keep an eye out for are physical symptoms. So if you see lots of headaches or stomach aches, or like nausea, but also if you see your child lose interest in activities that they used to like to enjoy, or increase fatigue, or just increased anger, those are some things you might wish to discuss with your child's pediatrician.
Distancing themselves a little bit. Healthcare Network, it's fairly new to our area. Tell us about some of the services that you guys offer.
So we are a federally qualified healthcare center, which means that we treat all patients regardless of their ability to pay or their insurance status. And one of the great things we offer is integrated primary care. So we have psychologists in all clinics with healthcare providers, and if there are concerns such as the back to school anxiety, the pediatrician or nurse practitioner can always call the psychologist into the room. And if there are more pressing concerns, we also offer traditional mental health services at the Nichols Community Healthcare Center. And if there are any questions or you want to get in touch about it, you can reach our services at 239-658-3000 or visit our website at healthcaresouthwestflorida.org.
Perfect. Dr. Tam, thanks so much for those, great tips. Just keeping the lines of communication open with your children, you have to do that.
I got my son a first day of class jitters book, I think, and we've been
that's
reading
cute.
that,
Yeah.
First day jitters, I think is what it was called, just to kind of ease that conversation. Kidsmindsmatter.com is also a great website. You see it right there at the bottom of your screen for resources. Thanks for joining us.
Oh, thank you for having me. My pleasure.